Rolling.
If you're watching this, I'm guessing that you probably are considering or have already scheduled a catheter ablation surgery. I just scheduled mine a couple days ago on my birthday, which was awesome, and I'll be having it the day after tomorrow. And I've been watching a bunch of videos, and there's some good ones, and I guess what I was trying to find was someone as similar to me as possible, age-wise and body type and whatever else, and also I was kind of trying to figure out what other people have been going through and what they're feeling, and both as far as the condition goes and dealing with the fact that you're having heart surgery, and I think I'm sure everyone basically has the same exact thought, which is you're not having a piece of glass pulled out of your thumb, or you're not having a procedure done on your knee. You're having heart surgery, which I think is really hard to get around mentally. But the more research I've done on it, and the more I've thought about it, to be honest, the more I'm starting to really submit to the idea of it. And I remember being on the phone with the nurse that was scheduling me, and I literally felt like I was like on the edge of a cliff, and I had that like vertigo feeling, and I guess I just wanted to tell you that will absolutely pass. I believe it will for you, and to be honest, it's almost been kind of a blessing in disguise, I guess. I've been having some especially bad SVTs the last few days. In fact, I was brought out of work in a wheelchair the other day and brought to the ER. So I guess in an ironic way, I kind of can't wait to get it over with. Like I really just want it to be done. And I hope through watching these kinds of things, you're kind of building some confidence and some optimism, and that's, I think, really the point of these things, or I hope it is. And I've seen a few people that have actually been pretty comforting to me, and I was able to talk to a nurse the other day that said some really encouraging things. And basically, again, I just want to tell you a little bit about me. So if you're anywhere near my age, which is 26. Again, I just turned 26, about a week ago. And as far as a little background about myself, I mean, I drank quite a bit of coffee until just, very recently, like within the last few days. And I do smoke cigarettes, which obviously is horrible. But yeah, I mean, if you, if you're a real person, you probably maybe don't play by all the rules just how you should, but I guess there's real no point in any of this other than to say, day after tomorrow I'll be able to tell you guys how it is, how it really is. And I've seen a few people talk about a few things they specifically remember from the surgery. The nurses that scheduled me, I mean, very much told me that I won't remember any of it. They assured me that I'm going to look up and see an IV dripping, and they'll put me into this twilight, and that's how it's been explained to me. And the next thing I'll know, the procedure will be done, and whether or not that we'll go that way, I'll be able to tell you. And also, and it sounds ridiculous, but I have a pretty high pain tolerance, but there's some people talking about pain in their chest, heart pain, and that absolutely just scares the hell out of me. I don't know exactly why, and I do have an anxiety disorder too, and I'm trying not to let that be too much of a factor here, but yeah, I think hearing it from the horse's mouth is probably the best thing for anybody right now. And also, too, it's been interesting for me because I don't personally know anybody that has this, and hearing some other people's stories and some of the symptoms that they've had has been, I guess, comforting or whatever it is. But I mean, I have had all kinds of scary stuff. I mean, and you know, I used to work out all the time. I used to work for the sheriff's department, and I stayed in really, really good shape. And I had a bunch of scary stuff happen. I mean, I remember a few times lifting weights or even just like doing push-ups. You know, my heart would flare up, and it would you know, be really, really, really difficult for me to catch my breath, even sometimes after a very, you know, light workout or at the beginning of a workout or whatever. Or I'll just go up and down, like literally I've walked up a couple of steps and had my heart flare up, and I thought I was really out of shape. I've thought all kinds of things. And then since I stopped working out, I've actually started to think I was developing like diabetes. Like, I mean, I'll just have all the life run out of me, just all of it, and it gets hard to catch my breath. And basically I was put on a beta blocker a year and a half ago, and my physician didn't really tell me much. I mean, he just basically said, hey, you need these and you're going to be on them the rest of your life. And you know, I'm kind of polite, and I just said okay, and took them, and had all these problems, and I had no idea what was going on. And then furthermore, my cardiologist that I've literally known for 3 minutes, I'm talking about, I went into her office, she literally came in, put the catheter that they're going to be using for my surgery in my hand, and she said, this is what I'm going to be using for your surgery, check it out, hands it to me. And it was probably the most morbid thing I've ever done in my life. I mean, I'm holding this thing and just trying to imagine it digging around in my heart, and well, very vividly imagining it digging around in my heart. And she just said, yeah, I'll see you in Milwaukee, and she walked out, and I thought maybe she was going to give me some pamphlets, or, you know, she was going to, I don't know, come back and kind of tell me some things, and no, that was it. She was gone, and before I knew it, there was a receptionist in the room, and she's like, okay, well, you know, we'll schedule that for you. And so everything I know has basically been from looking around online. So I guess if you're at a point where you're really rattled, you don't know what the hell's going on, and all you know is that there's people talking about giving you heart surgery, if this is the first video you're watching or an early one, I just want you to know there's a lot of people going through this. Tons of them. There's tons of people my age, older, younger. This is really common, and this is something, you know, that these doctors are doing every single day. And although, yeah, it's heart surgery, I mean, sure, but it's I think it's a really, really positive thing that we're doing. And I'm personally really looking forward to having my life back. And I've seen some other stories of people that have been going through this for like 30 years, and I can't imagine, I just cannot imagine having to live like that for that long. And I guess I'm just saying, if you're a young person and you're really freaked out and whatever else, like, just remember, like, you're getting your life back. Maybe for the first time. I mean, you know, I mean, depending on how bad it's been for how long. I mean, I watched a video of a lady, and she was talking about having fainting spells when she was like 15. I had those, and nobody ever figured out what it was. And there's just been so many things that I just, you know, assumed were with something else. You know, like my mom's side of the family has hypoglycemia, so I thought I was coming down with that, and I thought now I'm diabetic, and then I thought all these palpitations in my chest, well, that's just a panic attack, and it's been a cluster, you know. And I'm very much anticipating in a day and a half or 2 days time, I'm going to be making you a video telling you I'm so glad I did it, and I really believe that that's what's going to happen. And I've had a lot of time to think about it, and I think I've done a good job processing it, and I'm ready to go. I really am, and I hope through videos like this you can decide to do that too. So I wish all you the best of luck, and hopefully I'll see you soon. Thanks.